So we're talking about a diet that's centered around whole plant foods. And then there's certain foods that you should really up in your diet if you want to particularly reduce your risk of breast cancer. And those would be soy products, whole soy foods.
Continue watching to find out more.
The people of the Kingdom of Tonga would like to say malo elele to visitors, meaning hello in Tongan, one of the official languages. Delightful viewers, my name is Taina. The joyful people of this Pacific Island nation wish that your life shines brightly in the eternal light of God's glory. Getting access to genuine and truthful information regarding our health is a welcomed blessing. And we are indeed blessed to have with us today Dr. Debra Shapiro, an esteemed American medical doctor specializing in the field of women's health. Welcome to our program, Dr. Debra Shapiro, Vegan, Champion of Women's Health, Part 1 of 3. Dr. Shapiro is a board-certified obstetrician and gynecologist and has been practicing medicine for nearly 25 years. Having been constantly reminded by those struggling with chronic illnesses that are often reversible and lifestyle-related, Dr. Shapiro broadened her expertise by advancing her knowledge in plant-based nutrition and obtained a certificate in the area through the T. Colin Campbell Center for Nutrition Studies and D. Cornell. Apart from helping patients as a specialized surgeon, Dr. Shapiro became a vegan lifestyle coach and educator so that she could teach people the skills to help themselves through adopting a healthy vegan lifestyle. Dr. Shapiro also completed the Ruby course for whole plant foods cooking so she could guide her patients through the transition to a healthier and happier life. Furthermore, she is a diplomate of the American Board of Lifestyle Medicine. As a professional health coach, Dr. Shapiro is in a unique position to clarify issues related to diet and the well-being of the body, especially with regards to women's health and breast cancer.
I'm so glad that we're getting to talk about this because I cannot tell you how many times I've talked to women who have had breast cancer diagnoses or are worried about breast cancer, and they tell me that their doctor tells them they can't have soy and that they stay away from soy. They're not even really sure why, but they stay away from soy. And so let's clear this up. Soy, whole soy foods, we're talking about tempeh, tofu, and this is organic, edamame, soy milk. These are minimally processed whole soy foods, are extremely healthful and will reduce your risk of breast cancer.
According to the American Cancer Society, in the United States alone, it is estimated that 281,000 invasive breast cancer cases will be diagnosed in 2021, and 43,600 women will die from this disease. Dr. Shapiro finds that she often has to clear up the non-factual information regarding soy foods consumption and the condition.
So we're talking about a diet that's centered around whole plant foods. And then there's certain foods that you should really up in your diet if you want to particularly reduce your risk of breast cancer. And those would be soy products, whole soy foods. They will not increase your risk of breast cancer. They will also decrease the risk of prostate cancer in men. Now, initially, when studies were being done on soy, and especially on the soy phytoestrogen, they found that soy has something in it called isoflavones.
Isoflavones can be found in many plant-based foods, such as chickpeas, fava beans, peanuts, pistachios, and diverse fruits and nuts. But they are found in especially high concentrations in whole soy products, such as tofu, tempeh, miso, and soy milk. Isoflavones are a kind of plant estrogen known as phytoestrogen. However, they do not behave the same as the human estrogen hormone, which is known to be related to breast cancer in women. Dr. Shapiro explains how these isoflavones, or phytoestrogen, interact with the human body in beneficial ways.
We have 2 estrogen receptors in the breast and in other hormone-sensitive tissues. We have estrogen receptor alpha and estrogen receptor beta. And it turns out that mammalian estrogen sits in the alpha receptor and it accelerates growth. It's a growth-promoting hormone. That's what it does. But the phytoestrogens, the isoflavones, sit in the beta receptor primarily. And it actually puts the brake on growth. It's sort of an it actually modulates the growth and reduces the growth. So it actually protects against breast cancer. So eating more soy, especially early in life. So if you can actually start your baby off on breast milk and then move to soy milk, you can see almost a 50 or almost 60% decrease in breast cancer later in life.
Dr. Shapiro further elaborates on following a plant-based diet and a lessened risk of breast cancer.
When women eat a plant-based diet in general and more soy, they're going to see a 30% decrease in breast cancer anyway. But if you start earlier, even better, because you can even turn your body into something called an equal producer. And an equal producer means you get more of the benefit from soy. And we see that in people sort of in Asian countries where they grow up eating a lot of soy. They are these equal producers and they actually make something that actually further reduces the risk of breast cancer.
Whole soy products containing high concentrations of isoflavones can help create the further beneficial effect of producing equal in the digestive system of the human body. Not everyone has the bacteria required to transform isoflavones into equal. But a study found vegetarians are 4 times more likely to be able to produce equal compared to non-vegetarians. In addition to mitigating menopause symptoms, equal has other health benefits, such as increasing burn protection and reducing the risk of prostate cancer in men. Depending on environmental factors such as diet, human DNA can express itself differently. Dr. Shapiro takes us to explore the benefits of soy from a genetic perspective.
We know that some women have mutations in the gene that codes for DNA repair. For example, the BRCA gene. BRCA mutations, there are BRCA1 and 2. What it does is it codes for DNA repair. It repairs DNA, which is constantly being damaged by oxidative stress and inflammation. So if you have a defect, if you have a mutation in that gene, you're not going to be able to repair your DNA as well, and you're more at risk for breast cancer. Well, soy isoflavones upregulate the gene for DNA repair. So even if you carry that BRCA mutation, if you eat more soy, you're going to get more DNA repair, genetically speaking.
In addition to soy promoting DNA repair, Dr. Shapiro reveals how an estrogen-reducing pharmaceutical drug and isoflavones in soy share the same therapeutic mechanism.
Lastly, there's another class of drugs that we give women after breast cancer to prevent a recurrence, and they are called aromatase inhibitors. Aromatase is an enzyme that takes androgens and makes them into estrogens. So we use aromatase inhibitors, like Arimidex, for example, is a common drug, to lower your circulating estrogen so that you will have a lower risk of a recurrence of breast cancer. Well, it turns out that the soy phytoestrogens, the isoflavones in soy, as well as resveratrol and all those lignans that are in flax, they also act as aromatase inhibitors. And so that's how they decrease your risk of breast cancer.
Today, we will find why dairy products are not good for our health. Osteoporosis is a disease that is marked by reduced bone density. In the United States, 50% of women and 25% of men will experience an osteoporosis-related fracture in their lifetime. For generations, we've been taught that milk strengthens bones and helps prevent the condition. But does the scientific evidence really back that up?
Yes, another fallacy. And we've seen this over and over again in very large studies, that milk does not prevent osteoporosis. Osteoporosis is not a disease of calcium deficiency. It's a disease really of disuse, right? You need to pound your bones to make them strong. You do need adequate calcium, absolutely. But the calcium from cow's milk is not going to be helpful. And we know this because we've done studies. It was a very large study from Sweden that looked at over 100,000 people. And they actually found that when women had more than 3 milk products a day, they had more osteoporosis, more fractures, and more death from all-cause, higher mortality, all-cause mortality, than when they had less than 1 milk product a day. So milk absolutely does not do a body good. It seems to be a very acidic protein, which causes you to lose more calcium in your urine than calcium coming from plants.
How much calcium should we be getting daily, and what are good sources? Dr. Shapiro weighs in.
I would really try to get close to 1,000 milligrams of calcium a day. And you get calcium from low oxalate greens and legumes. And things like almonds and figs have calcium, and sesame seeds and tahini have calcium. But it's really the low oxalate greens, things like kale and collard greens, that have much more calcium.
Apart from making bones become more brittle, milk is dangerous for a number of other reasons, chiefly because it contains a protein called casein.
The casein gets turned in our body, this is the protein again, to be something called casomorphins. And casomorphins are short little chemicals, but they act like morphine in your brain. And so you actually are physically addicted. So I know so many people who say, I could never live without cheese. I could never give up cheese. I might have been one of those people actually a long time ago. But that's because you are physically addicted. And I remember eating pizza and there's a way that you just love that gooiness. And you think it's the gooiness, but it isn't. It's the casomorphins. And you actually are chemically addicted to cheese because of the casomorphins.
In addition to the addictive properties of casomorphins, Dr. Shapiro elaborates more on what harms milk can do to our body.
We know that milk protein increases something called IGF-1, insulin-like growth factor 1, and that makes tumors grow. That makes things grow. The other hormone that's in the protein that is accelerated by that milk protein is something called mTOR, mammalian targeted rapamycin, mTOR. This is the enzyme of aging, and it makes things grow, and which might be fine when you're a baby and you have it from your own mother's milk, but when you get it from a cow's milk, it makes things grow and it makes you age. So there's absolutely no benefit to this at all.
Lactose intolerance is a condition marked by bloating, diarrhea, and abdominal cramps, and occurs after eating or drinking dairy products.
It's an interesting thing that so many people are drinking dairy, because all over the world, most people actually cannot digest that lactose, that milk sugar. It's actually a mutation in Northern Europeans that has allowed them to continue to make the lactase enzyme that allows them to digest milk sugar. The rest of us are mostly lactose intolerant. Asians, Jews, Africans, African Americans, Native Americans are first people. They're all missing that lactase enzyme, and we're all suffering. I grew up suffering because of that.
According to a statistic from the World Health Organization, nearly 422 million people in the world have diabetes, and this number is likely to rise. Insulin is a very important hormone that regulates the blood sugar level in the body. Those with type 2 diabetes are resistant to insulin to varying degrees. Surprisingly, milk also can potentially take away our ability to make insulin.
In addition, there's bovine insulin in milk, and bovine insulin can actually be a trigger for type 1 diabetes in children that are genetically susceptible. And that's how, giving your children, going straight from mother's milk to cow's milk, can actually increase your risk of type 1 diabetes, which is a very serious type of diabetes where it's an autoimmune condition where you actually have antibodies against the islet cells in your pancreas that make insulin. And that may be because of this is called a genetic mimicry, that your body sees the bovine insulin and makes antibodies against it.
Normally after a meal, carbohydrates in foods such as bread, spaghetti, potatoes, etc. are broken down into glucose, which then enters the bloodstream. In response to a rise of glucose in the blood, insulin is produced by the pancreas so that glucose can be taken up by cells within the body for energy to do their work. When cells have enough glucose, excess amounts will then be stored in the liver in the form of glycogen for later use. However, when the body makes antibodies against its own cells that are responsible for making insulin, glucose can no longer be carried into the cells. As a result, the level of glucose will rise, thus causing a high blood sugar level. Prolonged elevated levels can lead to nerve, blood vessel, and/or kidney damage, as well as other issues like stroke and heart disease. For those with type 1 diabetes, high blood sugar can cause diabetic ketoacidosis, or DKA. Without glucose, the body has to get energy in some way. So the liver burns fatty acids and produces ketones as an alternative source of energy. Nevertheless, too many ketones in the blood can lead to DKA, a dangerous condition whereby people develop symptoms such as vomiting, dehydration, rapid heartbeat, etc. When this happens, urgent medical treatment is needed. Today, Dr. Shapiro will highlight how to choose the right diet to help prevent or reverse the condition, discuss how stress can affect a pregnancy, and reveal the 4 pillars she believes support excellent women's health.
Most heart attacks may be your last heart attack because they actually kill you. So heart disease is a huge problem. It's even more often than every minute somebody is having a heart attack and someone might be dying of a heart disease. But it is preventable with a healthy enough plant-based diet and other lifestyle changes. But you know, there are other cultures that never had heart disease, that do not have heart disease. For example, in rural China or in Africa, or the Tarahumara Indians in northern Mexico, when people eat more whole plant foods and they don't eat the typical Western diet that's so high in saturated fat and dietary cholesterol, they do not have heart disease at all, and it's pretty amazing.
For those who have already experienced the detrimental health effects of a meat diet, it's not too late yet. Dr. Shapiro tells us about the simple, life-changing solution.
Dr. Esselstyn at the Cleveland Clinic has been reversing heart disease, and other doctors all over in their own little practices have been using diet and lifestyle changes to reverse our number 1 killer. And it's so prevalent now and so known now that it can be done that a past president of the American College of Cardiology, Kim Williams, actually famously said that there are 2 types of cardiologists, vegans and those who haven't read the literature. This is amazing to think that heart disease can actually reverse if you just stand back and stop injuring your blood vessels with saturated fat and dietary cholesterol and salt and sugar and oils, that the plaques will resolve on their own, that your body wants to naturally heal itself if you just get out of the way.
Diet has a tremendous influence on our health regardless of age. What parents feed to children during their early years is critical to their wellness in future years. Also, a mother's meat-based diet can affect a child right at the beginning of life.
And they can see already in the blood vessels some thickening of the blood vessels. It starts in the womb. If you happen to be developing inside of somebody who eats a very high-fat diet, high saturated fat, and they're already obese, you're going to see these changes. By age 10, we're already seeing in children fatty streaks. By age 10, especially in this culture, probably not all over the world, and I mean absolutely not all over the world, but definitely in Western culture.
Epigenetics is the study of how one's behavior and environment affect gene expression. A pregnant woman's mental health influences the development of her baby, as Dr. Shapiro explains.
When I went through medical school in the late 80s, and when I started my practice, we didn't know about this. We really didn't know about epigenetics, and I didn't know that maternal stress would affect their fetus. But now I realize that it's very important to manage your stress while you're pregnant, even pre-pregnancy. Learn how to manage your stress with mindfulness meditation, laughter therapy, with your friends, and just knowing more about stress reduction. So that's a big part of our program also, managing stress and practicing mindfulness and practicing gratitude. It is very important.
Dr. Shapiro says there are 4 pillars that support a healthy lifestyle for women: a plant-based diet, sleep, exercise, and having connections with others.
So exercise is super important, and it's important also to release endorphins. These are the hormones that make you feel good. So you know when you eat sugar, you also get that dopamine release and you get that little high from sugar. Well, when you exercise, you also release endorphins, feel-good hormones. And another way that you get feel-good hormones and hormones that improve your mood is actually to eat a plant-based diet, because it changes the microbiome, the microbiota, the types of bacteria that are in your gut. And most of your serotonin, another very important hormone, in your dopamine, is made in your gut by these bacteria. And you will have much more of them if you eat a plant-based diet. The gut bacteria is completely different if you eat animal products. And people know this because when they go from eating a meat-based diet and they try to eat beans, it's like, oh, I can't do it, I got gas. That's because you've been feeding your bacteria certain kinds of food from day one, probably from the moment they put baby food in your mouth. You've been developing this kind of gut microbiome. But once you switch, you will get new bacteria, and they will be able to digest the plants just fine, but you'll need new bacteria. So you'll have more serotonin, more dopamine, more feel-good hormones like the endorphins if you exercise as well. So exercise and diet go together, and sleep. Sleep is a very important time for your brain to rejuvenate. This is the time, you can almost imagine that little garbage trucks go through your brain and pull out all the little tangles and the little plaque, and they get rid of them. So this is the time when you're sleeping that you can actually be reducing harmful chemicals and harmful fat and harmful toxins that can accumulate in your brain, like heavy metals, like iron, for example, heme iron, and aluminum, but especially to risk of Alzheimer's.
The practice of social distancing and lockdowns during the pandemic have changed the way people interact. Dr. Shapiro says we can make use of current technology to still stay in touch with the world, and should constantly remind ourselves to keep a positive attitude.
And lastly, we need connections. We notice this so much now with the current pandemic too. People are really suffering from being isolated. But do make that connection with people. Reach out to people. You can use the phone, you can use your computer, you can have Zoom. We have Zoom meetings with our families. You need to reach out. You need to have that human connection with people to stay well. You need to get up in the morning, get washed, get dressed. You need to connect with other people. You need to eat healthy food, and you need to get out in nature. I really think it's important to laugh still, to smile, to practice gratitude, and see the beauty in things still. Even though things have changed, and they may stay changed for a long time, you can't just stay in bed and pull the covers over your head. You have to get up, get dressed, eat healthy food, connect with others, and get out in nature. That would be my prescription for getting through this pandemic, and that's what I do every day. Be veg, go green, to save our world.
We thank you, Dr. Debra Shapiro, for your compassion and life-saving work, and for sharing with us your expertise in making lifestyle changes, including how to stay healthy during the pandemic. May your life be filled with God's love and blessings. For more information about Dr. Shapiro and her work, please visit anewviewoffood.com and pregnancyadvantage.net. Straight thinking viewers, thank you for your company on today's program. Up next is High Thinking and Simple Living, Part 5 of 5, on Between Master and Disciples, right after noteworthy news. May heaven's blessings always be upon you. Vegan side effect. Can't remember when you were seriously ill.
Our programs offer many languages. Please visit suprememastertv.com/schedule and suprememastertv.com/HL.